Hi, everybody. I'm Kenya Brown with Black Health 365. And as we kick off the month of March, you're probably gearing up to watch some basketball. But have you ever thought about scheduling a vasectomy? Today, we're talking about a topic that's important for men and their families vasectomies. Whether you're thinking about it for yourself, supporting a loved one, or just want to learn more, we've got you covered. Joining us is Dr. Gregory Hall, an internal medicine physician at University Hospitals, to break down the facts, clear up some common myths, and have an open conversation about male fertility and family planning. How you doing, Dr. Hall?
Doing great. How are you?
I'm doing well. You always got the 411 for us.
I hope so.
Now, this one is totally out of my wheelhouse now. We're talking vasectomies. Tell us about vasectomies. What is it and how does it work?
Well, simply put, a vasectomy is a way for a man to not be able to impregnate a woman. And so it allows, it basically, cuts off the flow of the sperm into the semen so that when you have sex, you don't impregnate anyone. So it's basically, and thinking about it, as a man, we tend to put the responsibility of birth control on the women, or we certainly would love that to be 100% your all's responsibility, right?
Sure.
But it's not fair, really. I mean, it's like get your tubes tied, do this, take birth control pills, thankfully, women will take a lot that responsibility a lot of time. But for men to be able to take their own responsibility on something and do something like a vasectomy after you've decided you don't want any more kids, which is a lot of the case, or just don't want kids in general, which is the case for some people, a vasectomy is a really good option.
Hmm. Now, I know that there are always myths that run around our communities about what it means, what it's going to do. What are some of the common myths that you've heard in your office? And then tell us what the real deal is.
Well, as you know, sometimes our friends and family can be our worst enemy when it comes to making a sensible decision, right?
Not on
Right?
purpose,
Or
but
maybe that's just my friends and my family, right? But
it's
um,
everyone.
but when people talk about getting a vasectomy, it's like, man, what if your wife and kids die in a car accident? Well, my wife and kids die in a car accident. I'm not going to have any more kids. I mean, it's,
That's
it's
true.
it's it's people will say something like that, but there's a time when you decide you don't want to have any kids, right? And there's nothing sadder than someone who wants to be involved with their father or wants to be involved with their mother and not able to, right? I mean, kids principally want a mother and father, right? And then there are people that say a father might say, "Oh, I'm the mother and the father," or a mother might say, "I'm the mother and the father," but no, you're not. I'm here to tell you, you're not, right? And they wish they had both a mother and a father for a number of reasons that we won't go into today. So if you decide you don't want any more kids as a man, a vasectomy is a good permanent decision where you have a little surgical procedure that's an outpatient. You don't have to get admitted to the hospital. You come in at 1 o'clock. By 3 o'clock, you're heading back home. So, I mean, that's a sensible decision to not have any further children. So I know a lot of people that have a number of children and they may get in their mid 30s or early 40s and say, yeah, I'm too old,
I'm
to
done.
have any
Yeah.
more kids. And
Yeah.
and I want to take control of this. I don't want to have to depend or talk someone into getting their tubes tied or depend on someone else taking care of the birth control aspect of their relationship. So vasectomy is a good choice.
Now, I know I've heard well, I don't know if it's a myth or whether it's just a driving thought that maybe things might not work the same,
Oh,
in those
yeah. I mean,
areas
well,
afterwards.
yeah, that's not the case. That I don't know that that's ever been the case, right? I mean, there's always some wild case where that may have happened, but that's not on the table at all in terms of I don't think that's not what the region they're dealing with has nothing to do with your erection or anything. I mean, it's all kind of done in the scrotal sac, your testicle area, and so there's nothing that would control your ability to get an erection or anything related to that. It's not anatomically possible, if you know what I'm saying. But you
Okay.
never say never, never say always, but that's not really on the table. I think the main thing that when people regret having a vasectomy is that they then meet the new love of their life that happens to be 15 years younger, and
Right, right.
she wants kids, right? And you've
Mhm.
already at 38 decided you didn't want to have any kids, but now you've got this person who wants kids, and now you had a vasectomy. Now that would be an option, and then but there are ways to reverse them, but they're really, you should not go into getting a vasectomy thinking about, well, I may change my mind. If you think you may change your mind, it's probably not the best option for you. But
Mhm.
that has happened when people will meet someone who wants kids and never had kids, and they want to have your kids. If you're 100% sure at 42, I don't want to raise anybody. I don't want to raise her kids. I don't want to raise anybody else's kids. Then it's a good option. But if you're not sure, or you're waiting, that's I would wait also as it relates to that. But for someone who's married and they've had the kids that they want, they're gonna be with the same woman. It's not a worry about getting STDs or anything. But you don't want your 42-year-old wife to get pregnant. A vasectomy is a really good choice.
Yes, and I do know people who have had to go in and get it reversed to, do IVF or different things like that. Is that a difficult process to kind of get that reversed if need
Well,
be?
it's not a difficult process to get it reversed, but it because of scarring and inflammation and things like that, it's not a reliable. It's not
Mhm.
reliable. So no one's going to tell you, yeah, you got 100% chance of this working, because it's just not that reliable. They did surgery to separate it. They can do surgery to reconnect it, but I just I would not go into it with that attitude. I mean, there's
Right.
certainly other options you can
Yes.
do, and if you have doubt, then that doubt is a reason to not do it, right?
So let's talk about other options. How does vasectomy compare to other types of birth control?
Well, I mean, the success rate is really good. I mean, if you compare it to condoms, condoms break, condoms do this, so the success rate. I mean, the vasectomy people. If someone gets pregnant after a vasectomy, it's like right after the vasectomy. You know what I'm saying?
Right.
It's not
Right.
after things have sort of settled in, and you're actually supposed to go for a follow up and give them a specimen, and so they can look under the microscope and see that there's no sperm there. And so once they see that there's no sperm, there's no way anyone's going to get pregnant. So it's 100% reliable if once you go through the process, the way you're supposed to. And it's not. It's like getting your tubes tied. I mean, you'd have to get them untied in order to get them
Yeah.
have it work. And even then, that's not be a reliable. It's not something you want to go to do. And many times it's seen as elective, so it's not something
Mhm.
that your insurance would cover. Your insurance probably would not cover a vasectomy reversal or any other kind of reversal that way, because you're making a decision that's not really medical, and they're always happy to do a vasectomy because now they don't have to pay for any future kids you have on your
Yes.
insurance. And so vasectomies are frequently covered by insurance, incidentally.
I love having these conversations because they get a chance to hear from a medical professional and, make some educated guesses other than asking uncles so and so,
I
about
always
their
say those
experience.
front porch conversations where
Yes,
you never
the
get
barbershop, the
yes, you
barbershop
never. Well, you
ones.
can
Yeah.
get some good information with the barbershop now, I know, but the front porch is never a good place to get medical information.
Absolutely. So tell us a little bit about what men should expect during the procedure and the recovery process.
Okay. Well, I mean, the procedures it's pretty easy. It's they say on TV, snip, snip, right? And it's a
That's the
pretty
part
easy.
that everybody is like covering their
Right,
heads at.
right.
Yeah.
That's the part that you kind of draw up about, but it's a pretty easy procedure overall. I mean, it's outpatient. You go in. I think it may take 15 minutes to actually do it.
Really?
45 minutes from getting on the table to getting off the table. They have to numb you up, obviously. It's the urologist and one other assistant. So it's just the three of you in a procedure room. It could be done in the office. Afterward, you apply some ice. There's not much in the way of pain. You're gonna, obviously you don't want to do any heavy lifting or things like that might break open any sort of incision, because there will be a little small incision on your scrotal sac and on both sides, the right side and the left side. But just almost like a pimple, basically, with some sutures that will dissolve. And they'll tell you 6 weeks of no heavy lifting, but it's really, it doesn't take 6 weeks to recover. In terms of you being off of work, you might, depending on what you're not, if your job is heavy lifting, you may take 6 weeks of heavy lifting off, right? But if you
Mhm.
have a work job like mine, or job like yours, you could really just take the weekend off and go back on Monday. You have some swelling of your scrotum, so you'll have big balls for for some weeks. You know what I mean? And so that'll resolve.
Yes.
But other than that, it's pretty easy.
So you know what they want to know. How long before they can get back to the activities?
Oh, well, probably a couple weeks. Couple weeks. It's not
Okay,
gonna
that's
take.
not
It's not
bad.
gonna take.
That's not
But
bad. I
you would still
mean,
want to make sure you would use protection, that person could still get pregnant. They're gonna have you come back in a month or 6 weeks in order to take that sample to make sure there's no sperm in there, right?
yes.
And then you're cleared to have to not worry about getting impregnating anyone. But in terms of just getting back and becoming sexually active again, a couple 3 weeks is probably all you need.
Now, why is it important for Black men to have open conversations about reproductive health and family planning?
Well, I think, Black men need to take responsibility for who they father, right? I mean, if
Listen,
you're going to become a father, you need to do that in a deliberate fashion, right?
yes,
You want to
absolutely.
know when you're going to become a father, and then you're going to then be a father, know about the responsibilities related to that, and know when you don't want to be a father, or who you don't want to father kids with, but
Yes.
most of it is having had kids and knowing that you have had enough of them. You know what I mean? I think
Yes.
that's what it is. I mean, there's certainly older people that have fathers. I mean, I had a patient yesterday who's in his late 50s, and they just adopted a 5-year-old and another 3-year-old of like family members, and then like I'm in for the long haul. You know what I mean? I'm like, God bless you for doing that.
Yes.
And so he thought about it, becoming a father, and now they're doing it, and he knows he's going in with his eyes open. So
Yes.
unfortunately, when people are just out there and they're just having random sex, and they don't, when they don't think of it as fathering children and the responsibilities associated with it, that's when things kind of go awry. So knowing that you don't want to have any kids, you don't want to be anyone else's father beyond what you've already done, or you don't want to do it at all, which people make those decisions as well. That's when you would come to someone like me and say, yeah, I want to be referred to a urologist for a vasectomy.
And I think knowledge is power. You
Mhm.
know, I anytime whether you feel like it's the best thing or the worst thing, you want to find out as much as you can about something, and then you can make an educated decision with what you want to do. So I love these conversations. I thank you so much, Dr. Hall, for being here with us today and helping better understand the importance of vasectomies. As we conclude today's segment, I encourage you to continue the conversation with your primary care provider. Call 216-714-2397 to schedule an appointment today. To learn more about our Black Health 365 program, visit wcakcleveland.com/BH365. Thanks so much, Dr. Hall.
Thanks so much for having me.
Make sure you share this video, y'all. Somebody need to know about this. All right. Until next time, y'all, I'm Kenya Brown.